Premier. So there's 356 locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and 4 cases, overseas cases. Clearly, we are still seeing people infectious in the community, so a clear message is every time you leave your house, assume you're coming into contact with someone who's potentially got COVID. It is sad that we've announced additional deaths today. There's been notified of an 80-year-old gentleman from southwestern Sydney who acquired his infection as part of the Liverpool hospital outbreak. He tested positive on the 29th of July and he was not vaccinated. As part of that Liverpool hospital outbreak, we have 7 staff and a student nurse and 29 patients impacted. And there have now been 6 deaths associated with this outbreak. Can I just say that New South Wales Health and the staff at Liverpool Hospital extend their sincere sympathy to the families and friends of these patients. And the death of any patient is felt deeply by the healthcare professionals who care for them, and a situation like this is tragic for everyone. The exposures occurred on a geriatric and neurology ward, and these patients are receiving the best possible care, but sadly many are older and have health conditions which leave them very vulnerable to the harmful effects of COVID. Staff at the Liverpool Hospital are providing care and support for these patients in extremely difficult circumstances. The hospital is one of the busiest in the state and continues to take every measure to keep the patients and staff safe during the current outbreak, while continuing to provide high quality care to the community. There's also a lady in her 80s from southwestern Sydney died at Liverpool Hospital, and she tested positive on August 4th, and her infection was not related to the Liverpool Hospital outbreak. She was not vaccinated. A man from Western Sydney died at Nepean Hospital. He was in his 70s and he tested positive on July 7th and he was not vaccinated. And then a man in his 80s from northern New South Wales died at Royal Prince Alfred Hospital, and he acquired his infection overseas and is not linked to the current outbreak, and he was also not vaccinated. In terms of an update on the situation in our regional centres, there's been no additional cases in the Byron, northern New South Wales area in relation to the case I spoke about yesterday. We had a gentleman and 2 of his children test positive, and there were a number of exposure sites. We have had no further cases linked to that exposure site, and can I thank the community for coming out for testing. There's been no additional cases in Tamworth or Armidale, and again thank the community for their response to the testing. We have had additional cases in relation to Newcastle, and there are a number of exposure venues that have been placed on the website for Newcastle. Again, thank you for the Newcastle community for coming out for testing in such high numbers. I do just want to also mention that we have had a confirmed case at the St George Aged Care Centre in Bexley. A confirmed case in a staff member worked 1 shift whilst infectious on 1 level at the facility, where 4 out of 8 residents have tested positive, and all 8 of the residents were vaccinated, and the staff member had received their first dose of vaccination. So appropriate care is being provided. Can I just echo the Premier's message about vaccination? We have high quality vaccines available to us in Australia, and it is incredibly important that people take up the opportunity to get vaccinated. It's important to get that first dose, but it's also important to complete your course. So we've been providing guidance, and that is consistent with the advice of the National Expert Advisory Group on Immunisation called ATAGI, that says in the current context, bring forward your second dose of your AstraZeneca to anywhere between 4 to 8 weeks. So if you have had your AstraZeneca vaccine in that period, your first dose, please bring forward your second dose. And as the Premier has also indicated, there's increasing access channels through pharmacies and general practice, and I urge you to make a booking to get your vaccine. Thank you.